questions that we received after our initial show. And again, as we said before, but I'll repeat it again, if you do have questions, it's real important that you get them to us. We want to hear from you. This show, as we said, is about you and your family. And the best way to get in touch with us is by email. It's at neuropathydoctor@gmail.com. Also, don't be afraid to go to our website. In fact, please do go to our website, neuropathydr.com. Subscribe to our weekly Sunday night email magazine called Beating Neuropathy and Chronic Pain. And that, again, is free of charge to yourself and even your doctor. We have many, many healthcare professionals that subscribe to our Beating Neuropathy Easy around the world. So with that said, I want to handle some of the questions that were received last week. The first question comes from Chelsea in Duxbury, Massachusetts. And she had a question that goes something like this. I'm slated to have surgery for X condition. Now, after listening to your show, I wonder if there may not be some alternatives that may allow me to defer my surgery or maybe even eliminate it. How do I find out? Well, the answer to that question really is to go to neuropathydr.com, look at the scroll-down menu for local treatment centers, and I'd invite you to call one of the local treatment centers and ask for a complimentary neuropathy analysis. That's a 15-minute segment that we will gladly give you in person. If you can't make it to the office or you'd rather spend the time on the phone, for whatever reason, we can arrange that too. So don't be afraid to go to neuropathydr.com, Chelsea, and get the information of the center nearest yourself, and come on in and see us or give us a call, and we're more than happy to see if we can help sort that out for you. Another question, which I thought was really important, comes from Timmy in Attleboro, and that question involves the use of self-medication. Is it possible that a family member who I observed self-medicated really contributed to the deterioration of her health? And unfortunately, the answer is yes. When we come back into the next segment of the show, one of the things we are going to be talking about is the role of medications, both prescription medications and over-the-counter medications, and some of the most serious adverse effects that we see. But the bottom line is that a lot of these medications and dietary supplements, especially taken without supervision, can have unintended consequences, as we say, and can have very, very negative effects. So certainly something to be aware of. So good questions once again. Sent to neuropathydoctor@gmail.com. Okay, well, let's move on a little bit and talk a little bit more about what we started to at the top of the segment today, and that is the causes of neuropathy. We spoke briefly about compression disorders that we see in chronic pain, but one of the things that I do want to mention is that unfortunately some of the medications that we take on quite a large basis in our society for two different conditions, one of course heart disease and related conditions, vascular disease, diseases of the cardiovascular system, can have very profound effects and can in fact aggravate or cause peripheral neuropathy, as far as we know. And another class of medications that patients sometimes take for high blood pressure can cause peripheral neuropathy. So we want to talk about that a little bit. Not to point fingers, but basically for purposes of education, you should be aware of these, and on your next visit to your healthcare provider or your neuropathy DR clinician, these are questions that you need to ask. It's also the reason that we say that when you are having chronic pain issues, that all your healthcare providers, us included, know the medications and the dietary supplements that you're on. Unless we know that, there's really no good way that we can help you, to the fullest extent. So, with that said, one of the well-known facts is that the group of medications called statin medications, those are the sometimes called or were once upon a time called the cholesterol-lowering medications, can have an impact on neuropathy. And unfortunately, it looks like a significant number of patients can develop neuropathy in association with the administration or taking of statin medication. Now, keep in mind that, as I tell patients all the time, good medicine, good health care is always a matter of risks, benefits. Just because a certain medication or drug can cause or has a side effect does not mean that you should stop taking that medication. So let me get that right out there. But it is a reason, however, to be aware, be armed with the knowledge, because knowledge is power, and have frank discussions with your healthcare providers, because if you do have neuropathy or have a combination of effect of health conditions that could combine and cause neuropathy, you want to know about it. You want to make sure all your physicians, your primary care, as well as anybody taking care of you, it has this knowledge as well, so they can point out alternatives for you. But the statin issue is a big one, because it wasn't that long ago where statins were heralded as, at one particular point in time, by very, very prominent medical journals. We thought that statins were going to be one of the saviors of mankind, and that's, not too far from the truth. The fact of the matter is that there are some good studies that have shown that when given over long periods of time, the incidence of cardiovascular recurrent effects can go down when patients take statin medications. The fact of the matter is that in many, many patients with a better lifestyle, a cleaner lifestyle, if you will, and more natural approaches, as my friend Mark Mincola talks about all the time, that we could probably reduce and in many cases probably eliminate the administration of statin medication, which of course is going to cut down on some of the cases of peripheral neuropathy that we see. One of the things I want to mention too is that there's a wide variety of what we call dose-response relationship in dietary supplements and in medications. It's a concept that was coined many, many years ago by a great biochemist called biochemical individuality. And the fact of the matter is that just because you're taking one dose that might be 10 times higher, or I'm again just making up that number, you're taking a dose that's significantly higher than your neighbor and you don't have any problems and she does, that could in fact be due to the whole issue of biochemical individuality. So it's certainly something that we want you to be aware of. Also, again, keep in mind that medications do have additive effects, so it's important that we know all the medications that you're on in addition to the dosages. And with that said, I think we're looking at our next break pretty soon. But again, one of the things I wanted to also mention is that if you go to our website, neuropathydr.com, go to the article library, which is the tab in the upper right-hand corner. You can pull down articles that we have published on statin and statin neuropathy. So once again, that's one class of medication that has a profound effect on health overall, can certainly have a bearing on chronic pain, which is why we're talking about it tonight. And when we do come back from the break, we're going to talk a little bit more about medications and their impact on chronic pain.